Hey, Dr. Dave here. Today we're going to demonstrate some of the technology we do here in the office. It's called the Insight Subluxation Station, and it looks like different varying degrees of health in what we do here. It's a way of monitoring a patient. It takes chiropractic out of just the pain aspect of chiropractic. It looks like how the body's functioning, what kind of stress is in the body, in the nervous system, in the muscular system. So I'll demonstrate some of the things we do here. Emily is kind enough to be a model today. She's an actual patient. This is her follow-up. What you're going to see here is what I do initially on patients when they first come in as a baseline, and then we do progress exams as the patient goes along to monitor how their body is changing, improving, healing, what needs to change during care. So it's a good monitoring tool. It's not dangerous, it's not invasive, it doesn't hurt at all. Unless I want to torture you, but usually I don't do that kind of thing here. No, but it's not harmful in any way, and so you could do these all day. It's not damaging or anything. So it's a great way to monitor people through care. So the first aspect we're going to look at is thermal scan, and the thermal scan looks at stress in the nervous system. The nervous system is our brain and spinal cord. These charts look at the nervous system. So for people that are not aware of the nervous system, again, it's the brain, the central nervous system is the brain and spinal cord. This system runs our entire life, all right? Everything we do, everything we experience, every aspect of life is experienced literally through this system. So think about how important that is. Is that important? Yeah, it's really important. So messages get sent from the brain, down the spine. All these messages go to our organs, our heart, our lungs, our digestive system, our reproductive system, our sinuses, hormonal system, immune system, everywhere. So we want to make sure that there aren't any stress or irritation or interference in those messages from the brain to body. And that's what this is going to look at. This other chart is, here's the spine, and these other things coming out, these yellow lines are nerves, and they leave the neck and they go all the way to our hands, in between all of our ribs, from the lower back all the way down to our feet. And so if you have problems in the spine, it can affect how symptoms you have in your arms or legs, or how they function in the muscles. It can give you symptoms of numbness, tingling, burning, sharp shooting pains, if there's problems in those areas of the spine and it's affecting those nerves. So this is just an idea to show you how important the spine is and where these nerves go, and this is how your body operates. So this technology is looking at stress in the nerve system, are the messages getting through properly, tension in the muscles, imbalance in the muscles, and then there's another thing called heart rate variability, which I'll go into afterwards. So we're going to do the thermal scan first. So usually fumble. Now to talk about Emily a little bit, Emily had scoliosis correction surgery. She has rods from somewhere around T3 to I think L3. You can see the scar here. And she came in with varying degrees of symptoms. She was having headaches, daily headaches. I think she was eating over-the-counter medicine like Tic Tacs. And so she was dealing with those for a few years. Her shoulders were very uneven. Her left shoulder was very elevated compared to the right. There's still some of that now, you can see. Her pelvis was tilted, and I'm going to make some markings here, some landmarks. S1. And this is simple. This is an infrared heat reading instrument, and all you do is start all the way at the bottom of the spine, and you do an even roll all the way up. So that was a thermal portion of this, looking at stress in the nervous system. Now what's interesting is you want actually all white. All white means that there's not a lot of tension or no tension in the nervous system, and information is being sent through the nervous system very well from the brain to body. Now if we look at her first scan, here's a upper left corner, you see these different areas of colors. These colors indicate stress and tension in the nerve system. The colors indicate how much. So green would be mild, blue would be moderate, red would be severe. There is a black that would be very severe. So she's showing these areas of stresses in the nerve system, and today's scan showing that it's clear. So that's an amazing result. Next technology we'll use is something called surface EMG, surface electromyography. Basically, that's looking at tension in the muscle system. Now you want even muscle tension on the spine. You want symmetry. You want symmetry because that's balance. Anything that's imbalance is going to create increased tension on the muscles, the ligaments, the tendons, the structures, and potentially lead to further problems. Degeneration of the cartilage, arthritic change, irritation to the nerves, nervous system, all that stuff. So we're getting a look at her muscular system. And this time we start in the upper neck, and then we go all the way down the spine. This one's showing tension in her muscles. The first one that we looked at, this was our original one. Anywhere you see all these colors or areas of stress and tension in her muscle system, she has a significant amount in her neck and in her upper back and her shoulders. You see these colors again, green is mild, blue is moderate, red is severe, and black is very severe. So she's showing all this tension and stress in her muscular system. This bottom one was an imbalance scale. Which side was pulling harder? The right side of her body was pulling much harder than her left. So her lower back on the left side was pulling harder, then it shifted to the right, then to the left, then back all the way to the right. This is what we want. This is considered normal. So it's pear-shaped, it's white in color, it has symmetry to it, right and left are the same. So we would want to get the person as close to this as possible. So this would be normal, this was hers, and this is her imbalance scale. So these are the different technologies that we look at as to monitor someone. So this was our first scan, and this was today's. I'm not going to be able to, I might be able to print up a asymmetry scale, but you can see significant difference change. All that stress and tension and black lines and red disappeared. She is still showing some neck tension, but she told me today that her neck is bothering her a little bit today. And so that started a couple days ago. So that might be picking up this tension in her neck right now. But in general, that's a lot different and a lot better than her initial scan. The next one we're going to do, and I won't show this because it's about 5 minutes long, but I'll describe it and demonstrate it. This is called pulse wave profiler. And basically the person puts their hand in this thing. Make sure it's comfortable. You ask the person, you feel 2 small bumps on the tip of your middle finger. And their job is to just keep their hand rested on here. Heart rate variability, which is this thing, is looking at actually the timing between heartbeats. And it's a gauge to look at overall health and well-being. I don't want to say it's new technology. It's been around for a while, but it's being used more as a measurement as far as overall health and well-being. So this could look at nervous system stress, the balance in the brain, parasympathetic, sympathetic, your fight or flight, your relaxation healing centers. Do you have balance in those systems? And if you didn't, there would be implications as to the problem of not having balance in those. But that would be an indication of health measures, I'll say. So that's called heart rate variability. It's looking at the timing between heartbeats, and you want to have a varying time between heartbeats. You don't want it to be stagnant. A higher heart rate variability is associated with better health. A lower heart rate variability is associated with not so good health. So typically what happens is the person just keeps their hand in here for about 4.5 minutes, and it takes readings, and then it'll give us a graph that looks like this. The graph is looking at what her heart rate variability is. This little white square represents the patient, where they are, and then it needs to be in this bigger square this bigger square with this green teardrop, and we will want her to be in that. In this scan, she had a high heart rate variability, but she was off in her parasympathetic nervous system, meaning that her brain nervous system was kind of in more of a parasympathetic, sluggish. I don't want to say depressed. People think that's emotionally, but depressed state. And we would want that more balanced in that, to have balance between both systems. So that's really what I wanted to talk about as far as the technology. One of the things we use here, why we use it, it's a way to gauge people through care, how their body is changing, healing, getting better, improving. You want to see that, because you don't want to just judge things by how you feel. Judging how we feel through care just based on pain could be misleading and dangerous, because as we know, people can have health issues and not feel them. So this is a way of just, again, showing somebody as you go through care, here's what's going on, because the tendency is to say, well, I'm feeling better, my pain is gone. But this looks at your physiology, your nervous system, your muscular system, and it brings a whole other dimension to chiropractic care and what we're measuring and how it's impacting your health and well-being. So I hope you find that useful. Thanks for tuning in. If you have any questions, please call the office and we can get you more information. Thanks.